Tuberculosis, commonly known as TB, is a bacterial infection that spreads through the lymph nodes and bloodstream to any organ in the body. It is most often found in the lungs. Most people who are exposed to TB never develop symptoms because the bacteria can live in an inactive form in the body. Many people are unaware that TB is still present in the U.S. and most importantly in North Carolina and Wake County, although the number of cases has declined thanks to the hard work of TB health professionals nationwide. So how is TB transmitted and who should be tested and who should not be tested? Well, joining us to talk about this disease is Dr. Jason Stout, TB Medical Director for the state of North Carolina and TB physician for Wake County, and Debbie Turner, a nurse with Wake County's Communicable Disease TB Control Division. Thank you so much for being here. Why are we talking about TB today? And, I was under the impression that we no longer really had wide cases of TB anywhere in the country. So why are we talking about it now?
So in part we're talking about it today specifically because World TB Day is coming up, which is the anniversary of the day in 1882 when Robert Koch discovered the germ that causes TB. And this is an opportunity to think about TB at this sort of time of year and think about where we're going. And TB is actually still really common in the world. There are approximately 8 million new cases every year in the world, and about 1.5 million people die of tuberculosis every year. So it's a big global health problem. Fortunately, in the United States, the number of TB cases has been coming down continuously, and so that we have many fewer cases. We had, in 2012, we had fewer than 10,000 cases in the United States. So it's a problem that still exists here, but it's a big global health problem.
What about in Wake County? What are you seeing on a daily basis or monthly basis in regards of cases found here?
Traditionally, we've seen between 40 and 50 new people diagnosed with tuberculosis a year. That's come down in recent years, so that in the last few years we're closer to the mid-20s. But I think that just looking at those numbers is a little bit deceptive because we have, in order to find those people that really have tuberculosis, you have to look at a lot more people who have symptoms that are concerning or chest x-rays that are concerning for the disease. In fact, we did a study recently looking at sort of what public health in TB spends its money on, and we spend probably about 14% of our costs on people who end up not having tuberculosis. So that's a big part of what we do.
Now, what's the difference between latent TB infection and active TB disease?
Right. So when a person is infected with tuberculosis, meaning they're near someone who has the germ in their lungs, that person coughs, sneezes, speaks, and aerosolizes the germ. And the other person who is susceptible breathes it in. The germ multiplies, infects that person, and in most cases, the immune system will contain it so the person does not develop symptoms. That's a state called latent tuberculosis or latent tuberculosis infection. However, about 5% of people with a normal immune system who are infected by the TB germ will go on in the next 2 years to get sick with TB, and that's called active TB. And another 5% will get sick at some point in the rest of their life, and that can be 10, 20, 30, 40 years later.
Now, Debbie, do you ever see cases where individuals can be susceptible to this disease more than once?
Yes, a person can be exposed more than one time. There are different strains of TB. People can come in and be exposed in a population to more than one strain of TB.
So how does Wake County Health Department get into this prevention mode, so to speak, in trying to educate and help folks understand about this disease? What is Wake County doing?
A case comes in, a suspect case, then what we have to do is look and screen contacts. We go employers, household, social groups, and we try to find out who has been around that person the most, and then depending on the number of positivity rate, being that they have been exposed to the germ, We will expand our contact investigation. And then once a person's been exposed, we really try to encourage them and explain and educate. You've been exposed to the germ. You do not have the disease. Now you need to take the preventative medicine to help decrease your chance of ever developing disease.
Right. Just to sort of add to that, so I think Wake County in particular has done 3 things to try to prevent tuberculosis. The first is what Debbie was just discussing, which is identifying people that have been recently exposed to the germ, screening them, and giving them medicine to prevent them from getting sick in the future. That's called a contact investigation. The second thing is identifying people who are at high risk, and in particular, it's usually people who come from countries where TB is common, screening them at the time of immigration, and giving those who are infected medicine to prevent getting sick in the future. The third thing, and perhaps one of the more innovative things that's being done, particularly in Wake County, has been community engagement. For example, we had a project that we were conducting for some years looking at neighborhoods in Wake County and which neighborhoods had higher numbers of people with tuberculosis residing in them. And through one of our outreach programs, we would go to those neighborhoods and offer free screening and free treatment, engaging the community. And that was an innovative effort, and I think it brought some results.
So, if folks have questions about this disease, who should they call?
They can call Wake County Human Services TB Control at 919-250-1228.
Dr. Jason Stout, Debbie Turner, thank you so much for being here to talk about this important health issue.
It was a pleasure. Thank you.